These are my favorite things to do to keep your fingers happy and healthy, particularly if you have joint problems like with the PIP or DIP joints. So first thing is pen rolling. So having a pen and you're just rolling it backwards, trying to make sure you're using all of your fingers, not just two of them. If this is too difficult because you have restrictions in range of motion, you can start with a larger pen, a big Sharpie or a highlighter, and do the rolling like that. And then you can graduate to a smaller pen and then to an even smaller pen. Next is tendon gliding. Now there are a bunch of different ways we can do this. Some are a little more fancy than others. One way is to start with your fingers totally straight, bend at the MCP joint here, and then hook the fingers down, and then straighten again at that MCP joint, curl it all the way down into a fist, and then back up straight. An alternative is to bend at the MCP joint and then go up into this hook position all the way down and all the way back up. You can absolutely just bend and straighten all the way. This works very well. You can even bend into the wrist as well. Next is finger extension strengthening. I will link to more specifics about this, but this is what this exercise looks like. Next we have PIP and DIP joint traction. And so really all we're going to do with this is we're just going to be pulling along the length of the finger. And so you can either grip with multiple fingers or you can do a ring lock around that finger and pull on it so that you're trying to gap that PIP joint or the DIP joint. And now what you'll notice is that when you pull on this, the MCP joint is much more mobile and it will gap quite a bit, and the PIP and DIP won't gap as much. So an alternative you can do is to block the MCP joint by using your thumb underneath the lowest segment of your finger, and now you can apply that traction to that PIP and DIP joint, and it won't be pulling on the MCP as much. Finally, to stretch the intrinsic muscles of the hand, the exercise that you can do is to pull the finger back at the MCP joint while keeping the PIP and the DIP joints bent. So that will ultimately look like this. And the goal is to push it back as far as you can. An alternative method is to make it more active, where you're going to be pushing the finger back with your other hand and then actively bending those other finger joints. If you have a lot of PIP or DIP joint pain and you can't bend your finger that much, or it's painful to push like this, which is very common, go ahead and use a pen cap or a chapstick or whatever you have to go, a carabiner, to go in the finger like that. So now we have support, and when we squeeze here, it doesn't hurt the joint. And then we can do the same thing, pushing it back like this. I'm demonstrating it like this so you can see it, but when you're doing it, you'll probably be doing it something like this.